Bloating is common, but common is not the same as normal for you. If your belly regularly feels tight, swollen, or painful, your body may be signaling that something needs attention. The goal isn't to panic. It's to notice patterns that separate harmless, occasional gas from bloating that keeps coming back, or comes with other red flags. Think of bloating as a symptom, not a diagnosis. Sometimes it's just a big meal, carbonated drinks, or eating too fast. Other times it's linked to digestion, hormones, inflammation, or how your gut handles certain carbs. In the next few minutes, you'll get a clear checklist of warning signs that suggest it's worth talking to a clinician. You'll also learn what details to track, because the story around the bloating often matters more than the bloating itself. If you've been brushing it off, this is your permission to take it seriously, calmly, and with good information. Moving to slide 2. First warning sign: bloating that's frequent and predictable. If it shows up most days, or several times a week, that's different from the occasional "I overdid it" feeling. Frequency matters because it suggests an ongoing trigger, not a one-off event. Pay attention to timing. Does it start within an hour of eating, or does it build through the day? Does it spike after certain meals, or even when you haven't eaten much? Also notice whether it's getting more common over months. A slow increase can be easy to normalize until you realize you've been uncomfortable for a long time. This is where a simple log helps. Track what you ate, how fast you ate, and when the bloating started. Add stress, sleep, and your bowel pattern. You're not trying to self-diagnose. You're creating a clean, useful timeline that helps a professional spot the most likely categories, like food intolerances, constipation, or gut sensitivity. Moving to slide 3. Second warning sign: bloating that comes with significant pain. Mild pressure is one thing. Pain that stops you from focusing, makes you curl up, or wakes you up is another. Pain changes the urgency because it can signal inflammation, obstruction, infection, or other conditions that need evaluation. Notice the quality of the pain. Is it cramping, burning, sharp, or a deep ache? Does it come in waves, or is it constant? Also notice location. Pain that's very localized, especially on one side, is worth mentioning. And watch for pain plus a firm, rigid belly. That combination is not something to wait out. Even if the pain eventually passes, recurring painful episodes deserve a medical conversation. When you describe it, avoid vague words like bad. Use a scale from 1 to 10, how long it lasts, and what else is happening at the same time. Clear descriptions lead to better, faster decisions. Moving to slide 4. Third warning sign: bloating plus unexplained weight loss or loss of appetite. Many people assume bloating means weight gain, but the more concerning pattern is feeling full quickly, eating less, and still losing weight without trying. That combination can point to problems with absorption, chronic inflammation, or other issues that deserve a proper workup. Also pay attention to early satiety, getting uncomfortably full after a small portion. If that's new for you, it's meaningful. Another clue is fatigue that doesn't match your sleep, because poor absorption or ongoing inflammation can affect energy. None of this proves a specific condition, but it raises the stakes. If you're tracking, write down your weight trend over several weeks, not day to day. Note appetite changes and whether nausea is present. And be honest about what unexplained means. No new diet, no major training change, no obvious stressor. Those details help a clinician decide what to check first. Moving to slide 5. Fourth warning sign: blood in the stool, black tarry stool, or vomiting blood, especially when bloating is also present. This is one of those areas where it's better to be cautious. Bright red blood can come from hemorrhoids, but it can also come from higher up. Black, sticky, tar-like stool can suggest bleeding in the upper digestive tract. And any vomiting of blood is a clear red flag. If you ever notice these, don't try to explain them away with the food you ate. Take it seriously and seek urgent medical guidance. Also, watch for bloating with new, persistent anemia. Low iron can sometimes show up as fatigue, shortness of breath with mild effort, or feeling unusually cold. You might not see blood, but your labs can hint at it. The key point is simple. Bloating plus signs of bleeding is not a wait-and-see situation. Moving to slide 6. Fifth warning sign: a major change in your bowel habits that lasts. That can mean new constipation, new diarrhea, or an unpredictable swing between the two. Occasional changes happen. But if your baseline shifts for weeks and bloating comes along for the ride, it's worth evaluating. Constipation can drive bloating because stool and gas move more slowly and the gut stretches. Diarrhea can drive bloating because of irritation, infection, or carbohydrate malabsorption that feeds gas production. Also look at stool shape. Pencil-thin stool or a sense of incomplete emptying can be important details. And pay attention to nighttime symptoms. Waking up to have diarrhea is more concerning than symptoms only during the day. The practical move is to track frequency, urgency, and consistency. A clinician may ask about the Bristol stool chart, but you can describe it in plain language. The point is change plus persistence, not one weird day. Moving to slide 7. Sixth warning sign: bloating with fever, chills, or feeling systemically unwell. Gas from a big meal usually doesn't come with a temperature or body aches. When bloating pairs with fever, it suggests your immune system is involved. That can happen with gastrointestinal infections, inflammatory conditions, or complications like diverticulitis in some people. Another clue is dehydration, dry mouth, dizziness when standing, or very dark urine, especially if diarrhea or vomiting is present. If you're immunocompromised, pregnant, or older, the threshold to get checked should be even lower. Also notice whether the bloating is paired with a racing heart or faintness. Those can be signs your body is under strain. The takeaway is simple. Bloating plus I feel sick is a different category than bloating plus I ate too much. If you're unsure, it's reasonable to ask for medical guidance sooner, rather than later. Moving to slide 8. Seventh warning sign: bloating that wakes you up at night, or symptoms that are clearly not tied to meals. Many functional issues, like swallowing air or certain food triggers, tend to follow eating patterns. When symptoms break that pattern, especially waking you from sleep, it can suggest inflammation or other processes that don't turn off overnight. Another version is bloating that's worst first thing in the morning, before you've eaten. That can happen, but it's a clue to look beyond simple overeating. Also, pay attention to whether the bloating is associated with nighttime reflux, nausea, or a sour taste. Those can point to upper GI involvement. None of this means something dangerous is happening. It means the pattern is less typical and worth describing clearly. If you keep a log, record the time you went to bed, any nighttime bathroom trips, and whether you woke from discomfort. Patterns at night are often diagnostically useful. Moving to slide 9. Eighth warning sign: bloating with difficulty swallowing, frequent choking, or a sensation that food gets stuck. That's not classic bloating, but it's a digestive red flag that can travel with upper GI problems. If swallowing feels progressively harder, or you're avoiding solid foods because they don't go down well, that deserves prompt evaluation. Another related clue is persistent vomiting, or vomiting that's not clearly explained by a stomach bug. If your stomach can't empty properly, you can feel full, distended, and nauseated. Also note severe heartburn that's new, especially if it comes with unintended weight loss or anemia. The reason this matters is that upper GI symptoms can change what tests are appropriate. When you describe swallowing issues, be specific. Is it liquids, solids, or both? Is it painful or just stuck? Precision helps clinicians narrow down causes much faster. Moving to slide 10. Ninth warning sign: new bloating after age 50, or bloating that's clearly different from your usual pattern. Age doesn't cause bloating by itself, but the risk profile changes over time, and new symptoms deserve a more careful look. The same is true if your bloating suddenly changes character, like it becomes more intense, more frequent, or comes with constipation that's new for you. Another important category is family history. If close relatives have had colon cancer, ovarian cancer, celiac disease, or inflammatory bowel disease, mention that early. It doesn't mean you have it. It means the threshold for evaluation may be lower. Also consider whether you've had recent travel, a new antibiotic course, or a major dietary shift. Those can change gut bacteria and bowel patterns. The theme here is new and persistent. When something is new for your body is giving you fresh information. Moving to slide 11. 10th warning sign: bloating with a visible, persistent abdominal distension that doesn't come and go. Many people have bloating that fluctuates, worse after meals, better in the morning. But if your abdomen looks enlarged for weeks, or you feel a sense of pressure that's steadily increasing, that's worth discussing promptly. In some cases, fluid buildup, organ enlargement, or masses can cause persistent distension. Another clue is shortness of breath from pressure, or needing to loosen clothing even without big meals. Also pay attention to swelling elsewhere, like ankles, which can point to fluid balance issues. This is not about self-examining or guessing. It's about noticing persistence and progression. If you can, record simple measurements at the same time of day, like waist circumference, for a week or two. Consistent growth is more informative than a single "I feel bigger" moment. Moving to slide 12, 11th warning sign, bloating paired with pelvic symptoms, especially in people with ovaries. This can include pelvic pain, a sense of heaviness, needing to urinate more often, or feeling full quickly. These symptoms can have many explanations, including benign ones. But the combination, bloating that's persistent plus pelvic or urinary changes, shouldn't be dismissed as just hormones. If your bloating tracks tightly with your menstrual cycle, that can be normal. What's more concerning is bloating that's new, persistent across the whole month, or clearly worsening. Also note bleeding between periods or after sex if that applies. The reason to mention this is that pelvic organs can influence abdominal pressure and digestive comfort. If your tracking symptoms include cycle day, pelvic discomfort, and urinary frequency, it gives your clinician a fuller map, and it helps avoid missing patterns that aren't purely digestive. Moving to slide 13, 12th warning sign, bloating with signs of malabsorption or food not being handled well. This can look like greasy, floating stool, unusually foul odor, or visible undigested food more often than expected. It can also look like nutrient issues over time, brittle nails, mouth sores, easy bruising, or persistent fatigue. Again, these are not diagnoses. They're clues that your digestion may not be breaking down or absorbing nutrients efficiently. Conditions like celiac disease, pancreatic insufficiency, or certain infections can present this way, and they require proper testing. Another related clue is bloating that reliably follows specific carbohydrate-heavy foods, like certain fruits, wheat products, or sugar alcohols. That can suggest FODMAP sensitivity, which is common, but still worth confirming thoughtfully. If you suspect food links, avoid cutting huge categories long-term without guidance. Instead, bring your pattern notes to a professional for a safer plan. Moving to slide 14. Let's turn this into action you can actually use. When you talk to a clinician about bloating, the most helpful information is the pattern, when it started, how often it happens, and what else comes with it. Bring a short list of your top triggers, your bowel changes, and any red flags, like bleeding, fever, weight loss, or nighttime symptoms. If you've had surgeries, new medications, or antibiotics, mention those too, because they can change gut motility and gut bacteria. You can also ask a focused question: what categories are you most concerned about, and what tests would rule them out? That keeps the conversation efficient. Now, a quick recap. Occasional bloating after a big meal is common. Bloating that's frequent, painful, persistent, or paired with systemic symptoms is worth checking. If you want more gut health breakdowns like this, subscribe and comment with your pattern. Is your bloating more like A, after meals, or B, later in the day? This information is not a substitute for medical advice. Optimize your biology, not just your diet.